afternoon. My name is Callie Smith, and today I'll be teaching my fellow nurses about culturally competent care. Culturally competent care means to be sensitive to the different cultures of patients, to interact effectively with people of different backgrounds and socioeconomic cultures. 4 components of culturally competent care is the awareness of your own culture. You must understand your own culture in order to give proper care to someone of a different culture. Another component is your attitude towards cultural differences. You must have an open mind when dealing with someone with a different culture. You can't be closed-minded and think that your culture is the only way to think. Knowledge of different cultural practices and cross-cultural skills. The importance of culturally competent care makes the patient feel comfortable with your care. You wouldn't want to feel uncomfortable with somebody coming in and doing things their way when it's the way that you believe is the way you think you should be treated. Patient outcomes improve because they feel respected and feel as though the nurse really cares about them. How to deliver culturally competent care. The nurse does not insert their own beliefs when caring for a patient. They recognize that the patient has different beliefs and that they should respect their beliefs and try to accommodate them. When doing procedures, covering the patient's body, providing privacy when taking them to the restroom, things like that also make them feel respected and less uncomfortable in the situation. This impacts the care by making the patient feel safe. Today I'm going to be talking about the Hispanic culture. Here in the USA we have a growing population of Hispanics. The majority of them live in Mexico and are coming to the United States for job opportunities. The primary language of the Hispanic culture is Spanish. The main religion that they believe is Catholic. Their behavior is very passive. They avoid attention. They avoid competitions. They don't go out of their way to be the spotlight. Their verbal expression is very limited. They don't have a lot of words. They're very just to the point, direct. They're quiet, reserved. When they are in pain, they usually don't show that they're in pain. They kind of wear a mask and let you think that they're doing fine. The men in the families work to support the wife and children. The women stay home and raise the children when financially stable. If not financially stable, they will go out and work in order to have enough money to raise their family. The Hispanic culture does not believe in birth control, so they tend to have more children. Also, they teach their children when they grow up to work and to want to work for a living and make money and better further their lives with being stable in the financial realm. In our line of work, women that breastfeed, most breastfeed exclusively. Starting out in the hospital, they tend to give a little bit of formula because they don't believe in giving colostrum. They deem it as dirty milk. That's just their culture. They just believe that. And it's our job to respect that and allow them to feed their baby however they wish. Many Hispanics do not have a primary health care provider, so they tend to follow the folk medicine or kind of herbal remedies more than our kind of medications. That's all I'm going to talk about today with the Hispanic culture. I hope that you learned a little something more about their culture and the way that we should treat people that have different cultures than we do. Thank you.